Hello, Uganda. Mwanguzi Shadrack from Health Touch Uganda. Today I'm going to be talking about something very important, and that's hypertension, commonly called high blood pressure. Some people want to put it as pressure, simply as pressure. Go to the hospital and they tell you have a high blood pressure. So today we are going to be talking about this very important component. Why am I calling it very important? We call hypertension a silent killer. This morning you might be okay, in the evening things have changed, or you might actually be okay by evening time, you have supper, even say prayer with your family, but by morning you are nowhere to be seen, or probably you've got a severe complication. You cannot stand on your two, you cannot hold something, you cannot say a word, or you're unconscious, or something really disastrous has happened. But when you were actually okay and you went to bed and everyone knew you were perfectly okay. So that's why we call it a silent killer, because it can take you by surprise, where you feel you are perfectly fine, but in no time something disastrous has already happened. It's very common in our settings, even worldwide. It's estimated that 1.28 billion adults between the age of 30 and 79 live with hypertension or high blood pressure. And part of this, majority of the people are in low-income countries, where our Uganda is also part. If you counted 100 people here in Uganda, you would almost find 30 of them with high blood pressure. And so unfortunate that out of these that are hypertensive, only a few of them get to know or live knowing that they have hypertension or high blood pressure. For example, if you counted 100 people that have high blood pressure, this is what I'm saying. You go to a random place, maybe a market, maybe on the streets of Kampala, if I can say, and measure randomly 100 people, you will find 30 of them with high blood pressure. Now, if you measured and you isolated every person you found with a high blood pressure, and you collect 100 of those that have an elevated or a high blood pressure, 100 of them, and then you start asking one by one to find out if they actually knew that they had a high blood pressure, you'd be surprised. Only 8 of them would be sure that they had a high blood pressure. Only 8 of them would be aware that they have a high blood pressure. But even out of these 8 that know that they have a high blood pressure, if you asked how many of them are doing something about it, how many of them are taking treatment, or how many of them are taking precautions to ensure that they don't get severe damages as a result of this high blood pressure that they have, the number will even be lower. So it's such a big problem, because it's with us. People actually have a high blood pressure, but they don't know. They don't know that they have it. They don't know that they need to do something about it. They don't know what to do about it. And yet, whether you know it or you don't know it, if you have it, it can cause severe damages, severe complications. So today we are going to be talking about what exactly it means to have a high blood pressure. What does it mean? How does it come about? When you go to the hospital and they tell you you have a high blood pressure, what should you understand? What does it mean? We are going to use the very simple language everyone can understand. Then we shall also talk about what causes a high blood pressure. What puts you at a risk of getting a high blood pressure? We shall talk about how you feel in your body, those things that should send a communication so you can go to a health facility for a blood pressure checkup. How do you feel? What do you experience? What are some of those symptoms? And we shall also talk about how can you prevent high blood pressure, if you don't have it, how are you supposed to behave? What are some of those things that you're supposed to do to prevent high blood pressure? In case you go and they tell you have it, how are you supposed to respond? What are you supposed to do in order to prevent the severe damages? You may not take it away completely, but you can keep it under control. So how are you supposed to keep that blood pressure under control so you don't get the severe damages that high blood pressure causes? And in case you have a high blood pressure and you don't do anything about it, because maybe you don't know that you have it, or you have it but because of one reason or another you don't do anything about it, what are some of the damages? What are some of those scariest events that can happen in case you have a high blood pressure? They're like complications, the things that you would be scared of, you would be worried about, that should trigger you to even go for a random blood pressure checkup. So those are the things that we are going to be talking about, and the rest will be responding to your questions. In case you have any question to do with high blood pressure, please send those questions to the appropriate social media platforms of Health Touch Uganda: Facebook, Instagram, WhatsApp, YouTube, Twitter. Just send a direct message and those questions will be responded to instantly. On WhatsApp, if you want to join any of the groups so you can gain direct access to these groups and ask those questions to our consultants directly, you can send a message and request to be added to any of the groups. You can send a message to 0753 924896. Just brief, just tell them kindly add me to any of the WhatsApp groups of Health Touch Uganda, and that will give you direct access to our consultants. So, what is high blood pressure? What does it mean when we say someone has hypertension? I want you to imagine water flowing through a pipe. This water is being pumped from the source by a water pump through a pipe. Maybe it's going to a certain garden or to a certain ground. Maybe we are dealing with an irrigation scheme where water is pumped from the source to the garden through a pipe by a machine or by a water pump. In this case, the water pump is the heart. The water being pumped is the blood, and the garden is the body, or the different parts of the body. This pipe are the blood vessels that carry blood from the heart to the different parts of the body. So as this water is flowing, it needs a pressure to keep it moving forward. And how do you know that this water is flowing at a low pressure, a high pressure, or a normal pressure? At the way it comes out from the jet or from the pipe as it flows out. If it is splashing, it's under pressure. If it's just dripping, that means it's under low pressure. It's the same thing that happens. There is a pressure that helps this blood to flow. How does this come about? Of course, as the blood flows, it exerts a force on the walls of the blood vessels. Just like the water, it exerts a force on the walls of the pipe, on the walls of this tube, as it tries to go through the walls direct, because it's supposed to be flowing forward, but some of it has a tendency of wanting to go through the walls of the pipe or the walls of the blood vessels direct at right angles. So that generates a force. That force exerted on the walls of the pipe, on the walls of the blood vessels, generates what we call a pressure. And this pressure helps this flow, helps whatever is flowing to flow forward. So what does that mean? It actually means everyone has a blood pressure. For everyone that is living, you have a blood pressure Why? Because as your blood is flowing through the blood vessels, through those tiny tubes that carry the blood, it exerts a force which builds the pressure. So everyone has a pressure, but the problem comes when the pressure is higher than normal. So there is a normal pressure, and there can be a low and a high pressure. For purposes of this video, we are only talking about a high blood pressure, as it's very dangerous. It's very dangerous. So when you simply say I have pressure, you're not making any communication, because everyone actually has a blood pressure. What probably you were told is you have a high blood pressure, and there are things responsible for making your blood pressure high. But generally, that's blood pressure. How do we measure blood pressure? There are machines which have been designed to measure your blood pressure. What these machines do is to detect the pressure in these blood vessels when your heart is pumping and when your heart is resting. When your heart is pumping, the machine takes a blood pressure reading which is recorded up, and when your heart is resting, the machine takes a pressure that's recorded down. That's why if you've been to a health facility and your blood pressure has been measured, they've written it with two figures, one up and one down. The one up represents the blood pressure in your vessels when your heart is pumping, and the one down is the blood pressure in your vessels when your heart is resting. Usually the one up is higher or is bigger than the one down. So when we measure your blood pressure and we find it 120 over 80, we shall tell you you are okay. When we find your blood pressure 140 over 90, today, tomorrow, the other day, we shall tell you you have a high blood pressure or you are hypertensive. So when we find your blood pressure 140, the upper one, or the one when your heart is pumping 140 and above, it can go higher than that. It can be 145, it can go up to 200, it can go up to 300. We tell you have a high blood pressure. When we find your lower figure 90 or higher, for example, it can be 95, it can be 100, it can be 120, it can be 150. Today, tomorrow, the other day, we tell you you have a high blood pressure, and we tell you you need to do something about it. So that's basically blood pressure. What are the risk factors for hypertension or for high blood pressure or for developing a high blood pressure? Risk factors, I mean those things that increase your chances of developing a high blood pressure. I will break this or categorize these into two. There are those that we call modifiable. There is something you can do about them. And if you avoided this, you would reduce your risks of becoming hypertensive or developing a high blood pressure. But there are those which are non-modifiable. There is nothing you can do about it, absolutely nothing. I will start with the modifiable risk factors. We have what we call an unhealthy diet. And the reason as to why high blood pressure is becoming more common and more common in our days is because people are tending to have more of the unhealthy diets even as the generations pass by. And that's why by the year 2025, we expect the number of people living with high blood pressure to have doubled. If today we say we have 1.28 billion people worldwide living with high blood pressure, we expect this number to have doubled by the year 2025. Why? Because of these things. People are having unhealthy diets. What do I mean when I say unhealthy diets? Excessive consumption of salt or salt. There are foods that have a lot of salt. Everything has a lot of salt. people add salt even to the sauce or to the food that they are eating, it's quite not good. I will tell you the correct amount of salt that you should have at least in a day. So a diet high in saturated fat, these are fats amasavu, which usually tend to be solid at room temperature. What do I mean? If you have fats amasavu at home, you put them in a room, they are not in a fridge or not where it's very hot, and they are solids, ngagekute chitole, they are the kind of fats we call saturated fats that are not good for your health. So omuzigo or ghee from any animal or from any source, and the animal fats that are solid at room temperature. There are other oils or there are other fats which are not solid at room temperature. Those ones are better, but those other fats that are solid at room temperature, some of us like putting them on bread, some of us like putting them in sauce. So those are unsaturated fats, and they increase your chances of developing a high blood pressure. Low intake of fruits and vegetables. There are people who live without taking greens, without eating fruits, or just once in a while. It's not good, because when you have your meals without fruits, without vegetables, your risks of developing high blood pressure increase. Besides an unhealthy diet, physical inactivity. There are people who spend almost the whole day seated. Maybe it might be due to the nature of the work you do. You spend most of the time seated, you spend most of the time in one place. That increases your risk of developing high blood pressure. Consumption of tobacco. The people who smoke tobacco, the people who chew tobacco, the people who use tobacco in any form, your chances of developing high blood pressure increase a little. Being overweight or obese. There are people who are obese like your body size is way too big, even as we compare it to your height. So people who are excessively overweight, people who are obese, stand a higher chance of developing high blood pressure. Those are some of the things that you can modify. You can really modify. There is something you can do about your weight. There is something you can do about tobacco consumption and alcohol consumption. There is something you can do about physical inactivity. There is something you can do about an unhealthy diet. Those are modifiable. There are these non-modifiable risk factors. Family history of hypertension. There are people in your families, there are people that have high blood pressure, maybe on the paternal side, on the maternal side. You have a relative, you have a sibling that has a high blood pressure. Once you have a sibling, once you have a relative or a family member that has a high blood pressure, your chances of developing high blood pressure are raised in a way. That's something that you cannot really do anything about. We don't choose the families where we are born, so it's quite non-modifiable. Then age. As people grow older, their risk of developing high blood pressure increases, especially over the age of 65. There are other diseases or comorbidities like diabetes, like kidney disease. When you have those other diseases, when you have those other illnesses, your risk of developing high blood pressure will go high. These risks I've been talking about usually don't work in isolation. You might find you have this, you're smoking, you have diabetes, you're drinking. So all those things, you have a positive family history of high blood pressure. There is someone in your family, a close relative who has high blood pressure, who has hypertension. That increases your risk of getting hypertension. So we shall emphasize how you could prevent high blood pressure when we are talking about prevention. So what are some of the common symptoms of hypertension? What are some of those things that you feel in your body when you have a high blood pressure? Now, I want to start by saying, like I said, hypertension or high blood pressure is a silent killer. Most of the people that live with hypertension actually don't know that they have it, and this is a problem because someone will just continue living normally. They don't know they have it, they don't feel a thing, they can't even think about it, but before they know it, they have a severe complication as a result of this long-standing uncontrolled high blood pressure. What does that actually mean? Even before I go on, every one of us has a responsibility to go and find out what their blood pressure is. At least once in a year, you need to know, or you need to go and they measure your blood pressure, because you can be there, you don't feel a thing, but when your high blood pressure is high, and if it's not attended to, it may not spare you. You may get those dangerous events or complications. But in some people, they feel certain things or they get certain symptoms. So if you feel any of these symptoms, please go and get your blood pressure measured. Some people feel early morning headaches. Every day you wake up in the morning, you feel a headache that sometimes you just don't attend to, or just take a simple painkiller and it goes. So early morning headaches can point towards high blood pressure. Some people start bleeding from the nose. Every time you bleed from the nose, you find yourself all of a sudden bleeding from the nose, it might point towards high blood pressure. Irregular heart beats. Sometimes you can feel your own heartbeat. Ideally, you're not supposed to feel your heartbeat. It's something that happens and you're not aware of. You don't get to know that your heart is beating. But when you start feeling your heart beating in the chest, maybe you have high blood pressure. So go and get it checked out. There are those that get vision changes. You start seeing blood things, cloud things. All of a sudden you don't see clearly. It might point towards high blood pressure. There are those who get buzzing in the ears. That funny sound in the ears. There is nothing around to cause that sound, but for you hear something buzzing in your ears. It might point towards a high blood pressure. Some people, when the blood pressure is very high, some people get fatigued, feel like you have been doing a lot of work, you feel so tired, you feel like someone who has really been running a long distance. You feel fatigued, and yet you've not been doing anything serious. It might be due to high blood pressure. Some people feel nauseated. Nausea is a feeling of wanting to vomit, and others even go ahead and vomit. Some people can get confused, don't know what's going on. You are not coordinated. You are generally confused. Some people become anxious. Anxiety, that feeling of pending doom, or like something disastrous has happened or is about to happen, like how you feel when you've been given bad news or when you expect something disastrous to happen. The same way you feel when you are going for an interview, when you have been caught doing something wrong. That anxiety, that unease, you feel your heart is pumping, you're sweating, you just feel unease. That's anxiety. So sometimes high blood pressure can cause anxiety. Some people feel chest pain. If you feel chest pain, go right away to the hospital and get your blood pressure measured. Some people get muscle tremors. All of a sudden you feel maybe your hands are shaking, or your legs, muscles, they are shaking, or tremors out of the blue. So those may point towards high blood pressure. If you feel any of those things, please go and get your blood pressure measured by a health professional. Your blood pressure, the measurement of your blood pressure is not painful. No one is going to prick you, no one is going to inject you. They're just going to put a cuff on your arm and pump or tap on a certain button. There will be a bit of discomfort, but it's not painful. So it should be very easy for you to go through that process. That's blood pressure measurement. Some people have automated devices in their homes. It's okay to have one, but it's better for you to go to a health professional once in a while for them to measure your blood pressure, so they can give you an expert opinion about your blood pressure. What are the complications of uncontrolled blood pressure? What are those severe damages, the severe events, the scariest moments, the scariest things that can happen to you when you have a high blood pressure that you have either not found out, no one has told you that you have a high blood pressure, or they told you but you didn't do a thing about it, so it remained high, uncontrolled for a long period of time? What are some of those things? I want to say high blood pressure can affect all the important organs in your body. It can affect your heart, it can affect your kidneys, it can affect your brain, it can affect your liver, it can affect your lungs. Literally, high blood pressure can affect all the parts of your body. It can affect your eyes, it can affect your private parts and functionality, your manhood, it can affect everything. But to be more specific, I want to tell you that elevated blood pressure makes the blood vessels, those pipes that carry blood in your body, hard and stiff, because they are trying to be strong. You know, when water is passing through a pipe, if the pipe is weak, it will burst. Now, the body was designed in a way that when there is a form of stress, it adjusts itself in order to meet the demands of the prevailing stress. So when the blood pressure starts to increase in your body, the blood vessels, those tiny pipes that take blood, will become hard and stiff so that they don't rupture, because rupturing is disastrous. Blood will leak in the different parts of the body and cause terrible things. So the blood vessels become stiff. But when they become stiff and hard, they lose a property of being able to expand. And yet, the ability to expand is supposed to protect you. It protects you. And when the blood pressure is also very high, they form bulges. Those blood vessels form bulges. If you've seen tires, if you've seen balls, when they are inflated with very high pressures, they form bulges. It's kabanga akamunde ba akazimbye akazimba kabanga akazimba. That kazimba or that bulge is a point of weakness which can rupture anytime, and if it ruptures, you are in trouble. The blood is going to leak in that particular part of the body where the blood vessel has ruptured and will cause issues. So these blood vessels can become stiff. It can be blood vessels in the brain, it can be blood vessels of the heart, it can be blood vessels in the kidneys, it can be blood vessels in really different parts of your body. So, and when these blood vessels become stiff, hard, they become even smaller, the amount of the blood that flows through them also reduces. Because remember, I told you they are supposed to have this ability to expand. So if they cannot expand well, it means when there is need for this particular part of the body to receive a lot of blood, in which case the blood vessels are supposed to expand to take in this much needed blood. It will not happen. This much blood needed will not go there. For example, when you start running or exercising, when you're frightened, when you engage in a physical activity, the demand on the heart to send a lot of blood increases. So when the demand is placed on the heart to send a lot of blood to the different parts of your body, to the legs, to the brain, to the muscles that are engaging in these physical activities or are engaging in the running, the exercising, the heart will start to overwork. And when it overworks, it also needs to be supplied with blood, because it's this blood that carries the nutrients, that carries the oxygen, that carries the raw materials the heart needs to continue functioning. So when it's not able to receive enough blood, it means it's not able to receive enough raw materials to help it work and send this. It's overworking, but it's not being fed. It's not receiving enough. What happens? You get problems. You get issues. You start feeling chest pain. You start, some people even get what we call a heart attack. You've heard about a heart attack. When the heart suddenly stops receiving blood, or when the blood supply to the heart is blocked and the muscles or the components of the heart start to die because they are not receiving enough oxygen. This oxygen comes with the blood. So the blood supply is cut off. So the heart is not receiving enough blood. So it's not receiving enough oxygen. The muscles of the heart, all the different parts of the heart start to die off, and we said someone has got a heart attack. So that can happen. But how is it coming about? Because you have a high blood pressure that is causing all these other issues. Some people, the heart may not go into that sudden kind of attack, but as it continues to work hard, because remember, when your blood pressure is high, when your blood pressure is high, your heart will be working harder than it is supposed to be. In order to overcome these pressures, I want you to imagine pushing against 5 people and pushing against 100 people. Which one is harder? It must be pushing against 100 people, keeping all circumstances constant. It's the same thing. When there is a high blood pressure in the vessels, it takes this heart extra effort to push blood against this high pressure, against this resistance, as opposed to a situation where someone has normal pressure, so the heart pumps normally. But people who have a high blood pressure, there is a lot of resistance to the incoming blood or the blood coming from the heart, so the heart has to use a lot of energy to pump this blood to overcome those high pressures. So as the heart does those things, as it tries to adjust, as it works harder, it keeps fading little by little, and the time comes where we see someone has heart failure. And when your heart fails, it's a disaster. It means different parts of the body will not be able to receive blood, because this heart is the pump that we talked about in the beginning, that keeps sending blood to the different parts of your body. So if it fails, parts of your body will not be receiving blood. Not receiving blood translates into not receiving nutrients, not receiving oxygen, not receiving water, not receiving the minerals, the vitamins, the different components that the body needs to continue functioning, for you to continue living. So Those are the people you find they cannot do much work or even anything at all. Someone moves just 5 footsteps, 5 stances, and they feel like they've been climbing a mountain for 5 hours. They easily get tired, they easily get fatigued. Why? Because their heart cannot support them properly. Those are people who feel they are breathless all the time. When someone lies flat on the ground, it feels like they are suffocating. It feels like they are drowning. They are air hungry. They are not able to breathe properly until they sit up, until they put something like a pillow, a big pillow behind them. The heart is fading. Those are people you find with swollen legs. The legs are swollen. Sometimes the swelling can be severe to involve the whole body. And when your heart fails, even your other body parts, even your other organs are liable to failing. So a high blood pressure can really affect your heart. It is the most common preventable cause of heart disease, if I can put it like that. High blood pressure is the commonest preventable cause of heart disease and heart failure. Hypertension can also cause your blood vessels to burst. For example, when the blood vessels going into the brain burst, what does it mean? Blood is going to leak into the brain, and that's disastrous. That's what we call stroke. You find someone has a stroke. Blood has leaked and caused damage to their brain. When your brain is damaged, there will be different parts of your body that will not function well, because the brain controls most of the parts of your body. Most of the parts of your body. For you to be able to see, for you to be able to hear, for you to be able to talk, for you to be able to understand what I'm saying, for you to be able to know different things, to remember different things, it's your brain working. For you to be able to walk from one place to another, for you to be able to lift your hand up or hold onto something, for you to be able to move, it's your brain working. So what does that mean? If a certain part of your body that's responsible for the movement of your left arm is affected, your left arm is not going to move. Even if we cut you, you're not going to remove it. If the part of your brain that's responsible for speaking is affected, it means you're not going to say a word. You might be able to understand and you really want to respond back, but because that part of your body responsible for speaking is down, has been affected by the stroke, by the leakage of this blood in your brain as a result of the ruptured blood vessels that came about as a result of an uncontrolled high blood pressure, you are not going to be able to respond back. And that's how bad a high blood pressure can be. So that's how you find someone in the morning, someone who went to bed perfectly okay, but in the morning you find maybe they fell on the ground from the bed. Probably as they tried getting out of the bed, they got a stroke, blood poured in their brain, or certain blood vessel in their brain was suddenly occluded or was suddenly blocked. So a certain part of the brain died off. It made them like that. They are paralyzed. One part of their body is numb. They don't feel a thing. They cannot move a part of the body. They cannot move that hand on the side, on that side. They cannot move the leg on that side. Sometimes some of them start convulsing or queska. Some of them become unconscious. They don't know what's going on. Some of them, the face shifts to one side. You find the mouth is deviated maybe to the left. They cannot open one of their eyes. Even when they try to talk, their tongue is very heavy. Why? because they've sustained a stroke that came as a result of this high blood pressure. That's how dangerous high blood pressure can be. High blood pressure can damage the kidneys. The kidneys are very, very, very important. Without the kidneys, you can't survive for long. But high blood pressure can affect the kidney. It can damage the kidneys and it can make your kidneys fail. Kidneys play an important role in filtering your blood or cleaning your blood, because we take in a lot of things, some of which can become poisonous if they are in high amounts in our blood. The foods that we eat, the drugs that we take, the drinks that we take, all of them can be converted into, in fact, are converted into substances or components that can be dangerous in high amounts in our bodies. Even that normal food you eat, when you eat your eggs, nutritious as they are, when you eat your chicken, nutritious as it is, if your kidneys are not functioning well, those foods, those eggs, that chicken is going to be converted into other things which need to be released, which need to be filtered out. So if the kidneys are not functioning well to filter them out, they are going to accumulate. And once they accumulate, they start causing different problems to the different parts of your body. And that's when people will start now to think of going for dialysis. Dialysis is very expensive. We have very few dialysis machines in the country, and even those few that are here are very expensive. There are only a few people that can afford 2 episodes of dialysis in a week. There are only few of them who can afford dialysis. The ultimate treatment of kidney disease is transplant. Is kidney transplant. But how many people can do kidney transplants? Can afford the cost of going for health care outside the country, because we don't do kidney transplant. For example, in Uganda here, you need a donor, you need a kidney donor. Who is even willing to give you their kidneys? Who is going to give you all that money? And yet there is something that you can prevent in the early stages before it causes these problems. So when you get kidney disease, when your kidneys are failing, that's when you start seeing your legs swelling up, your face swelling up, your abdomen swelling up with a lot of fluid in it. Some people get confused. Some people start looking pale because they have very little blood. And when you have very little blood, you get other issues. You can't do much. Your heart is pumping so fast, and it is even, you start feeling that bit of discomfort in the chest with the chest pain. You can't do a lot of work because you're weak. You easily get tired, and all those other things because your kidneys are failing. But why? Because you had a high blood pressure that was not controlled on time. So, how are you supposed to prevent high blood pressure? Assuming you go to a health facility for a blood pressure measurement or checkup, and they tell you don't have, what are you supposed to do? Because it doesn't mean that you are safe. You can still get it anytime. Remember, we talked about those risk factors, the modifiable and the non-modifiable. There are those non-modifiable ones which are not going to pay a lot of attention to because they are already non-modifiable. There is nothing you can do about them. If you're born in a family where some people have high blood pressure, there is nothing you're going to do about it. If you're someone who has other comorbidities, there is nothing you're going to do about it. probably it would be just treating those other illnesses. If you're still alive, you're going to keep growing, and by within no time you will be above 65 years of age. And yet we said once you get to 65 years and above, your risk of getting high blood pressure will go high. But there are these preventable ones, there are these modifiable ones that you can have control about. For example, reduce your salt intake. If you can afford to have about a spoonful, the total amount of salt you take in a day as a person to be a spoon, ekijiko cha sukari, the tablespoon. Of course, for people in families, you may be like, how am I going to do that? We cook together, the food is a lot. But don't worry about that, because the amount of salt put in the sauce is not all eaten by you. It's well distributed, so everyone has their own portion. But when they have put salt, it might not be enough. Don't add extra salt. And the salty foods, everything is salty. Try to reduce on that, so that at the end of the day you have taken in at least about a spoonful or less in a day. That's about 5 grams daily. You have to eat more fruit, you have to eat more vegetables. Those foods help in reducing the risks of developing high blood pressure. You have to be physically fit. If you can try to be active on a daily basis or regularly, it will be very good, regardless of the nature of the work you do. If you are someone that almost keeps the whole day in one position because of the nature of the work, I'm talking about receptionists, I'm talking about bankers, I'm talking about people that work in those offices where you have to sit and keep receiving people. It can even be a doctor, the doctors that offer consultation services, or any kind of work where you offer consultation services, so you keep seated the whole day, you stand a risk. So what do? Very early in the morning, before you set up for work, take off 20 minutes, just 20 minutes, and sweat. Do something in your room, do something in your compound. It can be as small as a 6 by 6 room, but you can still do exercises there, even if it means jogging in one place. You don't need to go to the field, you don't need to go to the stadium, you don't need to hit the streets. If you can't, well and good. If you can't, it shouldn't be an excuse. Take off those few minutes and sweat. Take off those 4 minutes and sweat in the morning. If you can repeat the same in the evening, it will be very good, so that you keep active, so that you keep physically fit. It will reduce your chances. If you are a smoker, it will be in the best interest of your health to quit smoking. Smoking, even besides high blood pressure, comes along with a lot of risks for other deadly medical conditions. There are a lot of medical conditions that come about as a result of smoking. You can get lung cancer or lung diseases just because of smoking. You can get heart diseases, you can get kidney diseases, you can get a lot of diseases just because you are a smoker, just because of smoking tobacco. I'm talking about tobacco. Other people smoke other things, but I'm talking about tobacco, smoking tobacco for this particular video. If you want to reduce your risk of developing high blood pressure and other deadly medical conditions. If you're someone that takes alcohol, it will be better to reduce on the amount of alcohol that you take. Kende za mwenge. If you want to avoid developing high blood pressure. If you have other medical conditions, you have kidney disease, you have endocrine diseases to do with parts of the body that make hormones, if you have cardiovascular diseases or diseases of the blood vessels, or any other illness, please seek medical attention. Seek medical attention. Seek medical attention so that you prevent this blood pressure before it comes. If you're someone that eats a lot of fats, a massive, it would be better to cut, especially on the consumption of those saturated fats I talked about, the ones which are solid at room temperature, when they are there, not in a fridge or not in a fridge, just room temperature, anywhere in the room, and they are solids, they are not good. Some of you put them on bread, some of you put them in sauce, omuzigo, the butter, because that will help you a lot. If they tell you that you have a high blood pressure, you also have a responsibility of doing all those things up that I've talked about. If you don't have high blood pressure, do all those things so you don't get a high blood pressure. If they tell you that you have a high blood pressure, you also have a responsibility of doing all those things so that this blood pressure does not go any higher. It does not increase in any way. On top of that, make sure you reduce on the things that stress you, because stress can cause your blood pressure to go high. For people that already have a high blood pressure and then you get stressed, that blood pressure will shoot and it will cause sudden problems, very dangerous problems. So make sure you reduce and find a way of managing your stress. The people around you should learn that you have a high blood pressure or that you live with high blood pressure, so that when they are trying to break bad news, when they are approaching you, they don't scare you, they don't give you bad news in a funny way. They have to find a better way of breaking the bad news to you. Why? Because your blood pressures can shoot and cause you issues. Make sure that you go for regular blood pressure checkups. I'm talking about people that have been told that they have a high blood pressure. These are the things now you should do. On top of the others I've said, make sure you manage and reduce those stresses. Go to health facilities regularly, at least twice in a month, to check for your blood pressure. Of course, they are going to start you on treatment. When you come to the hospital, we start you on treatment for high blood pressure. And you need to know that this treatment is working for you. Never stop taking your high blood pressure medication unless if you have been advised to do so by a professional health worker. I repeat that. Even when you find your blood pressure is normal this morning, because some of you have the machines, the digital machines that measure blood pressure, even when you find the blood pressure is normal, never stop taking your blood pressure medication until you have been told to do so by a professional health worker. Make sure if you have any other medical illnesses, they have been treated properly. Make sure they have been treated properly. It's our responsibility, I want to tell you. Prevention is better than cure. Every one of us stands a chance almost, because we are in the low income settings, and yet we said majority of the people that live with high blood pressure are actually found in low income settings where we are part, and we cannot run away. Most of the things I've been talking about, those risk factors, they cut across We eat those foods when we go for parties. Sometimes you might not be the smoker, an active smoker, but you might be seated or you pass where people are smoking and you take in. We call it being a passive smoker. All those things. I want to conclude by saying that high blood pressure is here to stay. It's very common out there on the streets. Very many people live with high blood pressure, but unfortunately only a few of them know that they have a high blood pressure. Even the few ones that know that they have a high blood pressure don't do what they are supposed to do. I also want to say that high blood pressure is dangerous and it kills. High blood pressure is a silent killer. You can be okay this evening, by tomorrow morning you are dead. Or you have got a complication that necessitates admission in a health facility. And this admission is going to take a lot of money that many people cannot afford if they are to pull out alive. So to prevent all those things, let's take precaution. Let it be our personal responsibility to go for regular blood pressure checkups. Once they tell us we don't have high blood pressures, let us make it a practice to do the things that will help us prevent developing high blood pressures. When they tell us that we have a high blood pressure, let's cast the fears, the worries, and the grief away and do the things that will keep us healthy, strong, and alive, because it's very possible. If you have any question about high blood pressure, like I said, channel those questions to our social media platforms. It's Health Touch Uganda everywhere, on Facebook, on Instagram, on Twitter, on YouTube, or even our WhatsApp. For WhatsApp, if you want to join any of our groups, there are many out there, just send a message, very precise, that kindly add me to Health Touch Uganda WhatsApp group to 0753 924896, and you'll be added instantly, and that gives you direct access to our professional medical consultants. Mwanguzi Shadrach, Health Touch Uganda, follow the light.